The ice is receding on the sacred mountain, as though it were tradition. One long walk, once a year, to remember our connection.
Okay, so this is Dr. Thornley, and this is part 11 of my medical marijuana series. And for my medical marijuana series, for the first 5 parts of my video series, I go over, just to recap, application, indication, dosaging, ratios, methods of taking it, because it's very complex. Right now, it's almost like a little bit of a cowboy science, because it's still not FDA approved, it's not in a pill, and you don't get a prescription. So it's an art of learning how to take it in different ways and understanding the mechanisms behind it. All right, and so the later part of my series, I like to delve a little bit more into the mechanisms, because I always want to understand why things work and why things are effective, which is the kind of mindset you need if you're practicing medicine. And then this is as a response to questions asked by my patients. So this is not medical advice, this is medical information. And I found that when I tried to research, there's a lot of scientific articles that are very detailed and very specific. And then there's also a lot of other articles which quotes from quotes, and they don't have the exact references. They're easier to understand, but I don't see the sources. So this is a response to fill that gap. All right, so today in part 11 of my series, I'm going to go over CBD-THC and its role in spasms and multiple sclerosis. So just as a recap, CBD, cannabidiol, is the non-psychoactive portion, has medical value. It's extracted extracted in a very distinctly way from the cannabis sativa plant. And then THC, tetrahydrocannabinol, is also extracted in a very different way. I went over this in the earlier part of my series for the medical value, and it's distinctly different from the THC that is smoked recreationally. So medical marijuana is not smoked. It's taken as a medication in different ways. So you have oral, you have creams, you have patches, and you have a vaporizer cartridge. Okay, so I digress. So that was just a short background, a very short, very quick recap of those other series, my earlier series. So going over into the specifics within the diseases. So there's all this overwhelming evidence finding that medical marijuana has properties that helps with a wide variety of neurological symptoms. And I found that reading more and more of these scientific articles, the receptors actually found quite diffusely with other organ systems as well. The Cb1 receptor is found predominantly within the nervous system. This is the basis on which THC acts. And we know it more from the stigmatized way when patients smoke it recreationally, but it's got a lot of medical properties. And because it's so abundant within the nervous system, this is probably why we see so many indications from a neurological standpoint. So in Europe, since 2010, there's a medication called Sativex, which is a combination of CBD and THC. So cannabidiol, the non-psychoactive portion of the plant, is usually combined with THC because it offsets side effects. They work synergistically, meaning by itself they're medically valuable, but together they work together to give even more benefit. And the CBD offsets side effects, including paranoia, agitation, hyperactivity of the THC. So in one study, there was one study where in 30 multiple sclerosis centers, 39% had discontinued treatment, and then of these, it was either due to side effects or it was not effective. But that's a total number of 1,615 patients. So on the flip side, 39% stopped it because of side effects and ineffectiveness, but that also means that 60% felt better, which is quite significant in such a large population. And I found that in reading these articles, the most common side effects normally include neuropsychiatric as well as GI symptoms. So I see a lot of articles mentioning nausea, vomiting, diarrhea, and these are at high doses. And then neuropsychiatric, you can get dizziness, somnolence, meaning sedation. Some patients can get suicidal ideations, depression, and feeling agitated. Also some reports of paranoia. And then in another study, in Spain, UK, Germany, Switzerland, in the UK, Germany, and Switzerland, 941 patients were studied, and they found that in the UK, 68% still were on it after 1 year. 30% discontinued it because of either side effects or no effectiveness. So the ones who discontinued it, 30% either had no effect, and then 25% had side effects. So this was from a study by Fernandez et al., European Neurology Journal in 2016. And then in Spain, there was a study on 204 patients where 70% still used it, and then after 1 year, 64% still benefited from using it. In another study, CBD-THC 1:1 ratio was found to be quite effective. So there's all these clinical studies. So most of my readings have been mostly European studies, and there's quite a wide variety of clinical studies in spasms and multiple sclerosis, which gives rise to the fact that it does have medical benefit, and it's helpful in spasms. Regardless of the side effects, they're considered mild to moderate. There was one death that was completely unrelated to the medication itself. So this proves that medical marijuana is effective in neurological symptoms, specifically in spasms and multiple sclerosis, as well as other neurological conditions. Okay, so this ends part 11 of my medical marijuana series, and this is Dr. Thornley signing off.